payer influence on clinical decision-making, the evolution of clinical pathways, increased focus on community outreach. How have the challenges in the oncology market caused practices to re-examine the way they provide care? And in what ways might care be impacted? Join us to find out. In the Know starts now. Hello and welcome to In the Know, your source for insight and analysis on the issues that matter to our dynamic healthcare market. I'm your host, Gina Clark. In part 2 of our look inside one of the country's largest oncology practices, we discuss the growing impact of payers in cancer treatment and what that means for patients. We'll gain insight on possible enhancements to the clinical pathways programs being deployed today. And we'll hear thoughts on what community oncology will look like 2 years from now, as well as the factors that affect that outlook. Joining us to address all of this is Bob Phelan, CEO for Integrated Community Oncology Network in Florida. Thank you for being with us today.
Thanks for the invitation, Gina.
Bob, in our last webisode, we focused primarily on the role that technology plays in the practice. For this webisode, I'd like to get your thoughts on the increasing role of payers in practice operations. For instance, how do payers influence the decision of practices to implement tools such as EMRs?
Well, you know, when we went back and looked at meaningful use and the government actually going to pay us for installing the EMRs into the system, what we've discovered is that some of the payers, at least what we're hearing, is that some of the payers will actually pay us for the same technology. Sadly, we haven't discovered anybody in Florida who's willing to do that yet, but at least we're hearing that kind of momentum is gaining some momentum throughout the country as well. So it'd be interesting to see in Florida if we can get that set up for us, because I think it would be really important for the payers to realize how important this system really is for them, and it's actually going to save them some money.
How does a large practice like ICON view proposed models for therapeutic cost management that involve clinical pathways and associated metrics?
Well, you know, the world of clinical pathways in Florida has really caught on, at least with the Blue Cross and Blue Shield episode with ICOR. We are not currently involved in the clinical pathways. What has happened, though, in the world of clinical pathways is it's become incredibly difficult for us in the world of authorizations. And these payers, at least the ones that have clinical pathways, are now beginning to require us to get significant authorizations for the drugs that we're using. And if anything, this has increased our costs because labor costs are more expensive because I have people who have to sit on the phone to get these authorizations. What's even more significant in that world of authorizations right now is the authorizations required for oral chemotherapy. If the oral chemotherapy is not, if you don't have a dispensing pharmacy in your facility and you have to get authorizations for oral chemotherapy, they can be incredibly time consuming. Some of those authorizations taking as long as 30 minutes. So while we think the pathways may be a good method to go down for actually treating the patients and doing better things for the patients, it probably hasn't been as productive for us in terms of reimbursement or as profitable for us in terms of reimbursement as we'd like it to have been.
Where might there be opportunities for improvements in payer-provider interactions?
Well, I think in the world of the payer interactions, one of the things we really need to develop is a better level of trust for each other. I mean, if we had more trust for each other, we would trust that their data is accurate, they trust that our data was accurate, and the process of moving down these pathways would actually be much easier for us because we would trust their data, they would trust our data, and obviously we'd both get paid well for that. Or we would get paid well for that, maybe they wouldn't necessarily get paid well for that, but they'd be able to share in the savings that pathways would produce for us. So I think one of the things we need to work on is just developing a better level of communication with the payers. If we can get to that spot, I think we can make pathways work for all of us.
What other models should be considered to balance care quality with therapeutic cost?
I think there's a number of models that exist in the universe today that we could all take a look at. Well, the first model obviously is the fee-for-service model. The fee-for-service model is the current model that we have right now. I think that some of the payers have begun to take the initiative of moving towards steerage. And by steerage, I mean we're looking at if we move all of our labs to a certain lab vendor, they would provide us with certain inducements or reimbursement incentives to move down that path. Or, for instance, if we moved all of our patients that needed lithotripsy to the right centers, or the correct centers in terms of what they want from a steerage standpoint. I think bundled services are the next pathway we could get to. And can we get the bundled services? It'd be a little more difficult for us to get there, but I think United Healthcare is moving in that direction with the pilot program. They have 5 practices throughout the United States that they're trying to get that to. And I think obviously the last method we could get to, if we could get there, is capitation. But for us to finally get to capitation, I think the practices really need to go back and look at some of those operational metrics that we talked about in the beginning. And by that I mean we need to make sure that we understand exactly what our costs are. I don't think that I or any of the physicians that I work for would be willing to move into the capitation arena unless they had a thorough understanding of what it actually costs them to do what it is they do.
How closely are you following the changes proposed with healthcare reform? And in what ways are you preparing?
Well, you know, I think that the changes for healthcare reform are coming. I don't think anybody really understands what the changes are really going to be yet. I think the government's still working on creating their 500-page voluminous book about what it's going to look like. So in our world, what we have tried to stay focused on is making sure that we understand those costs that I talked about for you and driving all the efficiencies that we can out of the practice. I mean, I think we need to look at everything that we do, every process that we do in the office, and make sure that we're saving money doing that. You know, one of the things we looked at when our office was looking at just changing some simple things in the office, looking at the vendors we do just to buy our supplies from. And when we went back and looked at this, in the med-onc world, we have 9 sites of service in Jacksonville. And when we looked at this from our practice standpoint, we actually saved about $70,000 just by standardizing the vendor we use for IV bags in the practice. So I think there's opportunities and many more opportunities for that in our world that we just need to make sure that we're looking at and using.
So let's switch gears here a little. We seem to be seeing an increase in competition in the oncology space. What does a practice like ICON do to maintain market share?
Well, you know, in our world, the competition really isn't as stringent. I mean, we have another competing group that's in town with us. But what I always tell my doctors, and I tell the employees too that work for me, you know, if we're providing the best patient care that we provide, the patients are going to come to us. And I think what you need to do is make sure that the patients know that you really care about them, you want to provide them with great care, that follow-up, the time we talked about labs, the things that you can do in the office to make sure that they're being treated, seen as quickly as they can and with as much compassion as you can will continue to bring the patients into the practice.
So Bob, has your approach to community outreach or referral generation changed any to adjust for the changes in the industry, whether it be competition or other issues?
You know, I think what's happening in the world right now is that we're seeing a change in the referral patterns because it used to come from the primary care physicians. I think what we're seeing now is more of those referrals actually coming to us, or at least a fair number of referrals come to us from the hospitalists. And the hospitalists are driving those referrals in a way that's a little bit different than what we're used to seeing, because the hospitalists used to produce their referrals based on relationships that they had with us, the end providers. And I think what's happening now is that those hospitalists are being owned by the hospital. The hospital actually pays their salary. So what's happening is the hospitals are basically telling them you need to either split them up or you need to send them to the other group because they send more ancillary services into our hospital. So we're seeing a shift in that we hadn't seen before.
That is very interesting, a point I was not aware of. So has ICON considered the use of social media and other web tools to connect with current or potential patients?
I think that as the web becomes more advanced and all the information you can find, anything you get instant pieces of information from the web, I think it's more important for us to develop a page that allows us to do things. I, for instance, just recently saw an orthopedic surgeon for a different reason, and in seeing that orthopedic surgeon, one of the things he didn't have was a portal that you could actually register online. And it was actually frustrating to me because I'm going in trying to actually do my registration online, and I couldn't get in to do my registration online, which is a service we provide to our patients here. You know, having that advertising online, though, I'm not so sure that that really is the methodology by which we get patients. I think if the patients are coming to us from out of town, sure, that may be a method for us to get it, but I still think that the main method of referrals in the practice comes from the physicians. So marketing there, I think, is where we need to at least develop to, because in the next 4, 5, 6 years, that'll be important. I don't think it's as important now as it will be for us in the future.
Just a couple of wrap-up questions as we close today. In what ways have your expectations for the oncology market changed? Do you still feel like you're able to do today what you did 5 years ago?
I think that we have been able to provide the same level of patient care that we were able to give. If anything, maybe a slightly even better level of care that we've been able to give before. As we move toward more standardization of supplies and equipment and drugs and even the methods by which we give the drugs, I think we'll continue to see an improvement in the way that we actually give the drugs or that we're able to provide service to the patients in the office. I think even in the world, that's the clinical side. And on the business side, I think what we need to do is make sure that we have in place every methodology and process that we can save money for the practice. I think we're going to continue to see this erosion of reimbursement from the payers. We're going to get squeezed from a bunch of different directions. Drug pricing and the marginal drug pricing is going to continue to get smaller. And what we need to do is to make sure that we have done everything as efficiently as we can to drive as much revenue out of the practice.
Can you state where you think the oncology marketplace will be in 2 years?
Boy, that'd be a tough question to answer, is where it's going to be in 2 years. I think in 2 years, we'll see more improvement in the areas of pathways. I think the payers are going to drive us more in that direction. We're going to be able to see the way in which that system has worked better for us and better for the patients. I'm not so sure what area. Well, I think in the area of, we're going to see more consolidations of the practices. We're going to see more hospitals, more practices that are moving towards hospitals. I think we're going to see the mega practices that are going to exist. We potentially could even see the whole state of Florida consolidate at some point. I think we're going to see more of that that's going to happen over the next 2 years. I think as the practices get squeezed more and more for reimbursement, they're going to have to look for ways to leverage their practice. Along those lines, too, I think it's very difficult for a smaller practice moving forward in today's environment because there are so many things that change and they're changing so fast. It's impossible for one manager to wear all the hats and have all the information that they need to have. I'm very lucky. I have a really good staff of people that work for me, and it provides me with the opportunity to just pass that buck on to them and let them take care of it for me.
So just kind of last question. What industry dynamics could change your prediction, depending on how they play out, whether it's healthcare reform, for example, or even new product development?
Well, I think that, as I said in one of my lectures that I had given to some of your groups, I think the tsunami that's hanging out on outside of this is the genomics, what's going to happen in the world of genomics and proteomics. I think the changes that are going to happen in those arenas are really going to change the face of how we practice oncology because it's going to be personalized and predictive. And I don't think anybody can predict when that's going to happen. I think it's certainly 2 years is probably a short vision for that to happen, but I think within 5 to 10 years we're going to see a proliferation of those kinds of companies and those kinds of services that are going to change the market completely.
Bob, this has been terrific information. Thanks so much for sharing all of your experiences and as you continue to lead an important oncology practice. Glad to have you here.
Thanks for having me.
And thank you for joining us. We'll be back soon with an all-new webisode. Until then, if it's on your mind, it's in the know.